you mentioned some incredible results that you've had in the athletic programs at University of Cincinnati in both preventing brain injuries and then treating them as soon as they happen. So a lot of this conversation that we'll have is going to revolve around helping people to recover from
Mhm.
concussion syndrome. But just to get it started, could you open up a little bit about the results that you've had in your program since you've been with Cincinnati?
Yeah, sure. Thanks for asking, Chad. So, what um, we have done at the University of Cincinnati is a lot of people have been focusing on things like biomarkers and helmets and that type of thing for, say, preventing or managing traumatic brain injury in the athletic population. And again, I do take care of other people, but in this case, with athletes. And what we did about 11 years ago is we initiated a whole revamp of our concussion program in athletics. And there's a lot of detail behind that, which we can go into.
Hmm.
You asked about the results. The results are kind of two major results. Result number one is that our concussion rate for athletes who went through that program, the concussion prevention program, the concussion rate went down 80%, 80%. So, for example, in football, the average concussion rate at the University of Cincinnati was about 10 concussions per year for the whole team. And that went down to 2.125. So, again, about 80%. Women's soccer would average about four concussions a year. Now they're averaging a little less than one a year, so about one every other year or so. Um, Other sports have seen similar types of things. So tremendous decrease in the concussion rate. Um, Rate that it takes to return to play. So in other words, if an athlete does get injured, because they do occur, there's no zero denominator here. Um, if a concussion does occur, our average athlete takes about 6.5 days to get better. The national average, depending upon lots and lots of different studies, the national average is between 14 and 21 days, 2 or 3 weeks. And our people are better in about a week or so on average. And that's because we start treating them pretty much right away, and they get some sort of evaluation or treatment or progression daily. And they're recovering, they're working hard, and they're recovering as soon as the injury occurs. So we work hard to get them better as well. So accelerated return to play, accelerated return to learn. This is a college population, and decrease incident rate for concussion.
That's just incredible. When you first shared that with me, like if we hadn't already talked enough and if I hadn't already trusted you, I would have thought you were lying. It's so unreal that you're having those results. But it
Right,
seems like it's something that other programs could implement, right? It's nothing special and unique about Joseph Clark. It's
right.
something that is duplicatable, right?
Well, yeah, there's 2 points to that. One is it does take work, and the other, it is duplicatable and it's sustainable. This has been sustained for 11 years. When these results first started, like we did a data analysis after 3 years and kind of didn't believe it, and did analysis for another 2 years and said, yeah, it's pretty much holding up. I mean, so
Hmm.
we're talking 5 and 10 years worth of research that is sustained.
That's remarkable. And didn't you also mention, remind me if I'm getting this wrong, but that you've only had one athlete have PCS symptoms for more than 3 weeks while on this program?
Right. So, of the 11 years that we've been doing this, we've had one athlete that was, if you don't mind me simplifying, sick for more than 3 weeks. Most of our people are definitely recovered in 3 weeks or less. And again, we worked hard to get that person better. But yes, so we believe that aggressive early intervention prevents chronic medical term sequela like post concussion syndrome.